But somebody squeeze her up and
There she
shows
is.
it's true Americana. Outpatient surgery came into the realm while I trained, and there were no outpatient facilities. Grab her up there, and then
Yeah, we got her.
and she won't bite.
Jesse, come around.
And then just kind of paper.
That's good. That's fine.
There were no outpatient facilities. I'm now an investor in an outpatient facility. The interesting issue, things cost too much, according to those in the insurance industry at the time. They said, no, we're not going to let you come into the hospital the night before, which actually was extremely efficient. Why? We got all their blood tests, all their clearances done in a single place, and if there was a problem, it could be dealt with or the case canceled. The point, though, at that time was that each night in the facility was charged by the facility. Well, it was because of the way the insurance product allowed for payment of service. You would think that you'd go into the hospital and there would be some form of a global, but it wasn't that. It was piecemeal. And that has been the undoing, in many ways, of what was then a reasonable thing to do. Then it became, quote, too expensive. And as the Reverend said, we now have a decision. We're going from a humane, reasonable thing to do to now, is it cost efficient to do it? And that's a huge problem. There shouldn't be a problem with someone coming in the night before and spending the night there. Put it on a global. The nurse isn't doing anything except drawing your blood, taking your blood pressure, turning off the light. How much does that cost? Nothing. But the hospital would tell you it costs a fortune. It doesn't cost anything. Now, what does it do the next day? Now we bring patients from Amarillo. They have to get to the hospital at 6 in the morning. I have to make sure that their clearances have been somewhat coordinated as an outpatient. I've got to get their cardiologist letter from Amarillo. I have to get their lab tests, check them. Then they have to schlep themselves and their families to the hospital at 6 in the morning for surgery at 7:30. It's actually somewhat ridiculous. The costs didn't really go down as they probably should have and could have, because collusion between hospitals and insurers was set up such that an outpatient surgery, because of our advances in technology, cost only half as much as it would cost if you spent 5 days in the hospital, instead of a fifth as much. I ask why, and no one can give me an answer.
You know, it's interesting, as we visit, I'm reminded of the story of the blind men who came across an elephant, and each one grabs a different part. And when asked, what is an elephant? Well, an elephant is this skinny little thing, you know, that's the person's got the trunk. And the other fellow says, well, what is an elephant? Well, it's just this great big thing over here. And then another one says, no, it's a tail. Isn't it interesting in this audience right here, in this small group? Each one of us seem to have kind of a different piece of this, and so maybe is that part of the complexity of the problem? Is each one of us, I think, bring up very valid points, but which one takes precedence of, you know? So we say to Delwin, go to Austin and fix this, and yet there's so many pieces to it. I mean, are y'all struck by the fact that even in this small group we have such a diversity?
Well, let me underscore something your dad said. As he so eloquently put it, for $3 visit and $1 for a shot of penicillin, he did very well. Put it in context of the time, how simple things were then. I reviewed for patients who are now adults with club feet records on microfiche from the old Lubbock Sanatorium. And their entire record for a 4-day hospital stay was 2 pages. For me to admit you tomorrow for a carpal tunnel release that takes me 4 minutes to do, you will have 40 pages of paper in your medical chart. It's insanity. It's bureaucracy. It's lunacy. That's where expenses are hidden and put away. All because of safety? No. Here's what happens. You get charged for 3 IV bags of fluid. $125 a bag, costs $2.50 to make. For a 4-minute operation? How did that happen? This is what we see. There is incredible inefficiency. These computers that are supposed to do such a great job do a great job at screwing it up. And this is reality today. My overhead was different, is different today than it was 20 years ago when I was entering residency, and then I thought about what things cost then and what I saw my mentors doing in terms of hip replacement, knee replacement, fracture care. And I looked forward and they said, things are going to be more expensive for you. I would never have dreamed that my overhead as a single physician in Lubbock, Texas would approach $1 million. For me to open my doors in the morning and close them at night, nearly 1 million American dollars before I take home a penny. Your dad didn't have that problem. Now, somebody's got to pay. What happened to the free clinics? I have to get myself on the wheel to make sure my nurses' salaries are paid, their health care is paid, my rent is paid. Then somehow it takes care of itself. But the system that has evolved has huge flaws. And it's because of bureaucracy and intervention along the way, and everybody gets their hand on a piece of the pie. Why does the outpatient surgery not cost 1/5 what the 5-day stay should be? No, it's 50 to 60% of what the old bill used to be, and they say we're saving you money. Wait a minute, somebody's walking away pretty lined up.
Okay, now see, Dr. May, he's got a comment in it.
Well, there's, let me borrow your microphone for a second here. Mark puts it very, very eloquently. There's one factor that ties this all together. We're all looking at different portions of the elephant, but the core of the elephant is the federal bureaucracy and the federal politicians which have created this entire mess, putting down endless rules, regulations. We have Medicare laws that go into the tens of thousands of pages. Normal care has been criminalized. If you don't file correctly, the feds can come in and shut your clinic down. Shut it down indefinitely.
Delwin, you're part of you're at the state level. You got to come about those guys up in Washington?
This is a different situation
know,
because it falls down, as Delwin said. They create the problem and then they dump it on the states with mandates, such as the health care, such as the CHIP plan and the other plans. They dump it on the states with mandates and they say, you will do this. That's why Governor Perry wisely turned down some of the money, because if he had taken the money, once that money ran out, the state would have had to provide that money.
I'll say this on Delwin's behalf. There are certainly many issues that the public in general would not really understand. One of which is tort reform, which is a state-based issue. And you hear the national arguments crying for tort reform. And the CBO, the Congressional Budget Office, just did an estimate where they think $54 billion could be saved with reasonable tort reform. And I must tell you, I don't know how your vote was, but you can say what it was. I have a hunch I do know what it was. Texas probably leads the nation in aggressive tort reform. Right, wrong, or indifferent. We are the leaders in the states, all of the United States, in tort reform. Every single state looks to Texas as the model. And you could underscore some of that.
Well, it's